Sexual desire and contraception. Estrogen, progesterone, and testosterone all play a role in female sexual desire, also called libido, and sexual functioning. Due to hormonal fluctuations, females are generally at the peak of sexual desire just before ovulation. There is generally less fluctuation in libido if you're using hormonal birth control methods, which affect hormone levels. Your libido may also fluctuate less after menopause. Undergoing surgery to remove your adrenal glands or ovaries cuts down on testosterone production, which can cause a drop in your libido. Pregnancy. During the luteal phase of your cycle, the rise in progesterone prepares your uterus to receive a fertilized egg. The uterine walls get thick and filled with nutrients and other fluids to sustain an embryo. Progesterone thickens the cervix to protect the uterus from bacteria and sperm. Estrogen levels are also higher, contributing to the thickening of the lining of the uterus. Both hormones help milk ducts in the breasts to dilate. As soon as conception takes place, you start to produce human chorionic gonadotropin hormone, HCG. This is the hormone that shows up in your urine and is used to test for pregnancy. It also boosts the production of estrogen and progesterone, preventing menstruation and helping to sustain the pregnancy. Human placental lactogen, HPL, is a hormone made by the placenta. In addition to providing nutrients for the baby, it helps stimulate milk glands for breastfeeding. Levels of another hormone called relaxin also rise during pregnancy. Relaxin aids in the implantation and growth of the placenta and helps stop contractions from happening too soon. As labor begins, this hormone helps relax ligaments in the pelvis. After childbirth and breastfeeding. Once pregnancy ends, hormone levels start to fall immediately. They eventually reach pre-pregnancy levels. A sudden, significant drop in estrogen and progesterone may be a contributing factor in the development of postpartum depression. Breastfeeding lowers estrogen levels and can prevent ovulation. This isn't always the case, however, so you'll still need birth control to prevent another pregnancy. Perimenopause and menopause. During perimenopause, the period leading up to menopause, hormone production in your ovaries slows down. Estrogen levels begin to fluctuate while progesterone levels start a steady decline. As your hormone levels drop, your vagina may become less lubricated. Some people experience a decrease in their libido and their menstrual cycle becomes irregular. When you have gone 12 months without a period, you have reached menopause. By this time, both estrogen and progesterone are holding steady at low levels. This typically happens around age 50. But like other phases of life, there's great variation in this. Decreased hormones after menopause may increase your risk of conditions such as thinning bones, osteoporosis, and cardiovascular disease. When to see your doctor? You should always see your primary care doctor or gynecologist once a year for a routine wellness exam. Your doctor can discuss these changes and answer any other questions you may have. Don't wait until your annual exam if you're experiencing unusual symptoms. See your doctor as soon as you can if you're experiencing morning sickness or other signs of pregnancy. Decreased sexual desire. Vaginal dryness or pain during sex. Skipped periods or increasingly irregular cycles. Difficulty conceiving. Pelvic pain. Hair loss or hair growth on your face or trunk. Depression after giving birth. Prolonged menopause symptoms that interfere with your life.